Hey kiddos, if you clicked on the right lesson, you should be on chapter 2 and you've completed chapter 1 and the assignments. In chapter 2, we're going to look at or talk about the healthcare structure. This is part 1 of chapter 2. I have placed quite a few definitions and abbreviations in the intro. I need you to get a notepad and a pencil or pen, and I need you to write these down. Study them because they will come up again in a test throughout this course. Don't forget you can pause the video to write these down. So don't say, oh my God, they're going too fast. Guess what? You can push the pause button. It's so awesome. As a phlebotomist, you'll have different opportunities to work in other departments. You can even work at a clinic. And like me, I did OB screening and teaching. So I did the education for the pregnant woman, and I would draw their blood, get history and physical, as well as genetic screening, and that can test for a number of genetic defects such as thalassemia or cystic fibrosis, hemophilia or Tay-Sachs disease, and other different inborn errors such as phenylketonuria or fructose intolerance. Inborn errors are rare genetic diseases that doesn't allow the body to properly turn food into energy. And so you can or will be testing for that as well, depending on where you work. One popular job that's on the rise is actually working for a doctor that goes to home. Uh, they can bring their own phlebotomist with them and even teach you how to do EKGs and other procedures because it's just you and him or you and her that are going house to house. So you can work alongside of a RN or a doctor in different departments such as the emergency department, which we call ED or ER, emergency room, or CCU, which is the cardiac care unit, or a nursery where there's maternity and pediatrics or labor and delivery, NICU, and and you can also work alongside a LPN or an LVN, which in different states they call them LPNs, licensed practical nurses, or LVN, licensed vocational nurse. As like any organization, it has a structure. And so here you see the displayed organizational chart, nursing maintenance structure, and even fiscal and informational services, support services, even from security to the ICU nurse to the doctor to the board of directors. You may encounter all of them. You're probably saying, what does insurance have to do with me? Well, in this job, you will have to sometimes collect insurance information, even put it on your requisition. You might even have to obtain what's called an ABN, Advanced Beneficiary Notice. It's like a waiver of liability. It's a notice to the patient, like informed consent that if Medicare does not cover something, that person will be obligated to pay. You either pay out of pocket for services or a portion of it. So that notice you would have to obtain that notice and get it signed. You may work in nuclear medicine where you would be tasked to do an RBC nuclear scan. And this is a test that tags RBCs, red blood cells. You would perform the venipuncture, so that's taking the blood out of the vein, and then they would separate the red blood cells from the sample and mix it with some radioactive material. Thereafter, they call those radioactive materials on the red blood cells tagged. And for a short time, that blood that they've mixed with the radioactive material or isotopes is re-injected into the vein, and then what they're trying to find out is or they'll scan the body to see how these cells are tracked, how they move throughout the body. A lot of times this is used for tumors or cancer, or gastrointestinal bleeding, which is bleeding from your stomach or your intestine, hemorrhaging. Other widely used reasons is to study the heart or lungs, liver, kidneys, blood circulation and volume, and even bone structure. It's also used for therapies. But I should also mention that it's also used for insect control, like sterilizing mosquitoes. But if you think about sterilizing mosquitoes, hey, you might not have a lot of malaria running around and killing people. So there's a positive. As a matter of fact, in all aspects of medical, phlebotomy is needed. The blood is like a blueprint of our body, how we live our lives, and what would be best for us to continue to live our lives. If you find out that someone has, or the doctor finds out they have high blood pressure due to high cholesterol because you did a fasting test and you did it right, you just saved somebody's life. I mean, it's so important that you do your job correctly. And always study because things do change. Science and medical is an ever-changing profession, and you would want that because how would we grow and know? We come a long way from figuring out that a circle actually can make a wheel. Okay, now let's talk about the two main areas: anatomical and surgical pathology area, and then the clinical pathology area. Both areas are closely related. So the way I remember it, anatomical and surgical pathology, I look at anatomical, right? So I look at, and also it analyzes cells and tissue, just like an anatomical structure. A person that would be standing in an anatomical position. We are looking at the cells and tissue which makes up a body. When it comes to the clinical pathology area that analyzes blood and other bodily fluids, I want to think of, I'm going to the clinic to get my blood drawn, or, I got to get a pap smear. So now we're looking at, clinical pathology. A lot of times I will use word association throughout this class, and I think it helps, it always has helped me to remember things. Like, let's break down cytogenetics. Think of genetics, such as chromosomal disorders, or cyto, meaning cells. Pathology is the study of the causes of diseases. So you might have to bring a tissue sample that the doctor has aspirated from a patient during surgery, or even a pap smear, and you won't actually perform the procedure, but you are tasked with the transportation of that and processing of that sample. And histology is really just the preparation of the tissue via an autopsy or from surgery or a biopsy, so the pathologist can take a look at it and determine its morphology or disease.